Mary retired in Ohio with a Medicare Advantage plan she loved. Then she moved to Florida to be closer to her daughter. 3 months later, she got a bill for $14,000 because her plan didn't cover her in Florida. No one warned her. I call this the state line coverage gap, and I want you to be ready. Here's what most people don't understand. Original Medicare travels with you nationwide, but private Medicare coverage doesn't always work that way. Medicare Advantage plans are tied to service areas, and if you move out of your plan's service area, you may need to choose new coverage during a special enrollment period. For example, if you see a doctor in Ohio and then move to Florida, Original Medicare still generally pays its share, but your private plan may not work the same way after the move. But here's where it quietly unravels. Most people don't have just Original Medicare standing alone. They have something layered on top of it, either a Medicare supplement or a Medicare Advantage plan. And that second layer, that's where the state line matters. Your Medicare card works everywhere. Your plan may not, and no one during enrollment explained the catch. Let me walk you through the biggest one. If you have a Medicare Advantage plan, and more than half of eligible beneficiaries do, your plan is network-based. That network is built around a service area, and that service area is typically county-specific. What that means in plain language, if you move out of your plan's county, your plan may no longer cover you. Not a different copay, not a higher deductible, no coverage. Now, here's what catches people off guard. They call their plan before they move. The representative says, "We have network providers in Florida." That sounds like it works. But having network providers in a state is not the same as your plan being authorized to cover you in that state. Two completely different things. I've seen retirees move across the country and discover, only when they need care, that they've been paying premiums for a plan that stopped covering them the day their address changed. Now, if you have a Medicare supplement, sometimes called Medigap, you might be thinking, "I'm fine. Medigap travels with me." And you're partially right. A Medigap plan does work with any doctor who accepts Original Medicare in any state. But here's what many people don't realize. If you move to a new state and you want to change your supplement plan, maybe the pricing is better where you're going, or your current plan isn't competitively priced in the new state, you may have to apply for a new plan. And that application can require medical underwriting. And if you leave a Medicare Advantage plan because you moved out of its service area, you may have a federal guaranteed issue right to buy certain Medigap plans if you switch back to Original Medicare and act within the deadline. Outside those protected situations, changing Medigap plans may involve medical underwriting. So you may arrive in your new state with the right to keep your old supplement, but not always a guaranteed right to switch to a different one. That's the fine print no one reads until they're already unpacked. Now, here's what many people don't realize. There is a window of protection if you time it right, but if you miss it, you could be locked into a plan you can't change and a network that doesn't reach you. When you move, Medicare does give you a special enrollment period. If you have a Medicare Advantage plan and you move out of its service area, you have the right to switch plans. You can move to another Advantage plan in your new area, or you can drop Advantage entirely and go back to Original Medicare with a supplement and a drug plan. That window is not unlimited, and the rules are different depending on whether you're on Advantage or Medigap. For Advantage, you typically have until the last day of the second month after your move. For Medigap, some states offer a guaranteed issue window when you're leaving an Advantage plan, but not all states, and the timing is tight. Here's what I would do. Before you move, not after, I would call your plan and ask 2 questions. 1, does my current plan cover me in the county I'm moving to? And 2, if I need to switch, what is my enrollment window and when does it close? Get those answers in writing. That one phone call could protect you from a gap you didn't know was coming. There's one more group I want to address directly. If you're on Medicare because of a disability, you're under 65, and you're moving states, listen carefully. Some states offer stronger protections for people on Medicare under 65 who want a Medigap plan. Other states may offer fewer options. If you move from a state with stronger under 65 Medigap protections to one with fewer protections, you could arrive and find that your options are much more limited. I don't know about you, but I don't like unlimited exposure. If you're under 65 and on Medicare, check your destination state's Medigap rules before you change your address. This is the kind of detail that doesn't show up in a brochure. And if you're someone who splits time between 2 states, Maybe you live in New York and winter in Florida. You need to hear this too. A Medicare Advantage plan generally requires you to live in its service area for more than 6 months of the year. If you're truly splitting time, you may be outside that plan's rules without knowing it. Original Medicare with a Medigap supplement is the flexible structure here. It follows you, any provider, any state, any season. If Snowbird Life is your plan, your Medicare structure should match that flexibility. Let me bring this together the way I would if you were sitting across from me. Here is exactly how I would approach Medicare before a move across state lines. First, I would identify whether I have a Medicare Advantage plan or a Medicare supplement. That distinction determines everything that follows. Second, if I have an Advantage plan, I would verify in writing whether my current plan covers me in my destination county, not whether there are network providers there, whether the plan is authorized to cover me there. Third, if I have a Medigap supplement and I want to change plans in my new state, I would check whether I qualify for a guaranteed issue window. If I don't, I would talk to a licensed Medicare specialist about my options before I submit any application. One wrong application can trigger a denial that follows you. Fourth, if I'm under 65 and on Medicare, I would research my destination state's guarantee issue laws before I commit to a move. And fifth, if I'm a snowbird, I would make sure my plan structure matches my lifestyle, not the other way around. Most people don't get caught by Medicare across state lines because they're careless. They get caught because they assumed federal means portable, and no one corrected them until it was too late. Because planning isn't just paperwork, it's alignment. If this sparked even one question, consider subscribing and share it with someone who's retiring, relocating, or splitting time between states. They need to hear this before they change their address, not after. Florida Medicare Guidance, nationwide remote online notarization. Licensed in life, health, and annuities since 2013. Information is available here on the channel if it's ever needed.